Your hospital, as I understand it, 300 beds, a private institution. What is the situation in your hospital right now?
Situation in the private hospital or any other hospital in India is pretty bad. We are in a situation wherein there are a lot of patients begging for a bed in the hospital, and we are unable to provide them bed because the number of the patients are more, and the beds which are available right now for these critical patients, we have a very less number of patients. So overall scenario, I would say, is very dim, very gruesome right now.
So you're having to turn patients away who want to get care at your hospital. You've actually, Dr. Shah, sent us in some video that you yourself filmed, and I'm going to show you the first little bit we're going to show our viewers is the lineup of ambulances. I'm wondering what happens to people when your hospital turns them away. Where do they go, and what are these people in these ambulances waiting for?
So this is one of the most tragic scenes and tragic scenarios that we come across day in, day out. These are the ambulances which we call it 108. These are emergency ambulances. So whenever you call for an emergency shifting to some patient, you call 108 and ambulance is there within 10 minutes. At this point of time, because most of the ambulances are occupied in taking these patients to different hospitals, there is a waiting period of almost 7 to 8 hours to get an emergency ambulance. So that is the situation there. So right now, if I don't have the bed, then the patient, they move around in this ambulance to different hospitals and try to find out where the bed is available. So instances are there wherein patients, they die in the ambulance. In the meantime, they get any bed, because it may take somewhere around 7, 8 hours, 10 hours to just get a bed in any of the hospital which is available.
Isn't that incredible?
It is incredible situation, you can't imagine. And whenever I get a phone call, my relative is having saturation of 80%, my relative saturation is 60%, please give bed. And I'm helpless because I cannot give them bed. My full hospital is full. My 50 ventilators are full. My 15 HFNCs are full. My BiPAPs, I have 15 BiPAPs, all are full. So practically I don't have space to keep any one single patient.
No space,
so
no
everybody
equipment.
is facing that same situation everywhere.
And those numbers you were giving, 60% oxygen saturation, 80%. For a healthy person, we'd be almost 100. We'd be in upper 90s. These are people who are having tremendous difficulty breathing, and they need some help, and you can't give it. I want to show some other video. You mentioned people dying in ambulances because they can't get into the hospital. It's not just people in the hospital. I mean, there are people, this video, this young man on oxygen, is this in his own vehicle, Dr. Shah?
Yeah, that is why, because you don't get ambulances, you don't have free ambulances, though people are getting shifted in their own vehicles. They get some cylinders from somewhere, and then they go from one hospital to other hospital to find out if they can get a bed over here. So this is the same patient who had been traveling around for almost 3 to 4 hours, and ultimately he got a bed at our own hospital, and we got admitted him. He's still in the hospital right now. He's just a young guy, 28 years old, suffering from very bad pneumonia because of COVID-19.
So these are patients who, as sick as they are, can't even get into hospital. What are the patients you are seeing who actually do have those beds? How sick are they, and what kind of care are you having to give them?
This time, I would say the virus which has been there, it's a double mutant virus. See, we have faced even the first wave also in India. And at that point of time, we were quite comfortable, and we were able to manage a lot of things in a very comfortable way. But this time, this virus is more virulent, very infective, and it spreads very fast. And this time, it is specifically affecting particularly the lungs the more. And within a days of probably 4 or 5 days, these patients, they have a fired lungs. Their oxygen saturations, instead of 9,900, they go down to almost 80. And within a period of 8-10 days, these patients, they die. So this time the virus is very deadly virus. I would say it's a monster which is on a roll road and killing patients like anything. The numbers that are given out is probably, I would say, a very small number. There are a huge number of patients who are dying and who are getting admitted in the hospital.
That's exactly what the world has suspected, that these numbers is very low compared to what the reality is. A monster that is killing patients like anything. And I would imagine putting people like you in a very dangerous position as you deal with all of these patients. Have you yourself, Dr. Shah, had COVID? I've heard of other doctors who have, or family members. Has your immediate circle been affected by all of this?
By God's grace, till date, I am non-COVID. I think so. It's God's grace. But let me tell you, there are n number of doctors and n number of medical personnel who have got infected with COVID. Even after getting 2 doses of vaccines, there are a lot of doctors who have been infected with this variant. So probably I would say, yes, the disease pattern or the disease process is not very, very bad. They get a milder infection and they come out. But yes, you're not totally immune by getting a vaccine, and you're not safe also.
And so few people in India.
So a lot of doctors are infected here.
Yes, and so few people we know in India are vaccinated to this point, only about 2%. It looks from afar like things are out of control almost. I'm wondering a couple of things. How bad do you think it's going to get, and how on earth does it come to an end?
See, bad, I would say it is the spike which is coming up. And at this point, if we are short of the beds, we are short of oxygen, we are short of medicines, even just like routine medicines like steroids, even antifungal medications, then remdesivir, tocilizumab, so monoclonal antibodies. There is significant short supply everywhere. So because of the short supply, you can treat them with the minimal of assistance with these patients. What we are giving is oral dexamethasone. That is what is freely available everywhere, and some of the antibiotics. But if you think of remdesivir, which is considered to be, I would say, a very good medications against this COVID-19, it is significant because in India, you need almost, I would say, 3 lakh numbers of remdesivir injections per day. Against that, in India, we are able to produce almost 1 to 1.5 lakh vials of remdesivir. So we are real short of that because of increased usage of steroids. Steroids are in short supply.
Right.
We are not getting now nasal cannula for oxygen supply. There is a short supply of rebreathing mask also, and obviously the PPE kits also. Slowly that is increasing, the demand is increasing. And for example, I would say the oxygen, it is the basic thing which is required in any pneumonic patient. In our own hospital, the routine consumption of oxygen is just 1 metric ton per day. That has increased to almost 3 metric tons per day. So that is the increased requirement. Against that, the companies and the factories which are producing this liquid oxygen, they have fixed capacity to produce that oxygen. And so they are giving us on a ration basis. So instead of 3 metric ton, they are supplying us 2 metric ton of oxygen right now.
Yes.
So again, because of this situation, we need to modify our policies. We need to modify the patient criteria. We need to triage the patient, which patient to take and which patient to be discharged on an early basis.
Dr. Shah, it's been shocking to see the scenes and equally shocking to hear the details from a professional like you. I hope you'll let us stay in touch, and we'll check back as seemingly things continue to worsen with all of those shortages. It's really worrisome, and we wish you the very best of luck. Thank you very much for talking to us today. Many, many Canadians very close to India with family there and watching the story with tremendous interest. Thank you, Dr. Shah.
Thank you.